this is a presentation on chitosan magnesium alloy coronary stents. I'm Gigi, this is Juan, that's Laura, and that's Deb.
So coronary artery disease is caused by plaque buildup in the coronary artery, which causes a reduced blood flow to the heart, resulting in death of the heart. Coronary artery disease kills over 370,000 Americans yearly, and over 1 million stents are placed in order to deal with it. This treatment costs approximately $100 billion each year, and yet the stents aren't perfect. In at least 10% of all of the stents, restenosis, where the tissue grows back in over the stent or the plaque covers it, closing the artery again, restenosis occurs in at least 10% of the stents, where thrombosis or blood clotting occurs in at least 16% of them. This is partially due to the stents being 1,000 to 100,000 times mechanically stiffer than the surrounding coronary artery. Due to this, we needed to create a bio-inspired and biodegradable polymer-based stent in order to reduce the occurrence of restenosis and thrombosis in the coronary artery.
So what is our approach? Our approach is to develop a biodegradable, non-toxic, and soft tissue compatible stent composed of a chitosan-based film with a magnesium alloy strip. So the chitosan we're going to be used for the specific application will have a molecular weight between 190 and 375 kilodalton. The chitosan membrane will be prepped by a solvent casting in an aqueous acidic acid solution. It would then be dried and neutralized using a 0.1 molar of sodium hydroxide for approximately 10 minutes. The pure chitosan will then be cut into small segments and chemically fixed into a 3% aqueous genopin solution, which is a natural crosslinker, for approximately 6 hours in order to enhance the mechanical strength. The chitosan with the genopin will be loaded with the sirolimus drug and coated with the heparin to control drug delivery in order to address thrombosis. The chitosan will then coat the magnesium alloy, and then together they would be seeded with the vascular endothelial growth factors to address restenosis.
So the great value of our stents came from the fact that it combines the benefits of our magnesium alloy, of chitosan, of heparin, and sirolimus, and so on. As you can see, we came out to so the stent came out to be biocompatible, biodegradable, can last up to 6 months, non-toxic, good mechanical strength, wound healing properties, and so many benefits, as you can see, and with a good cost of, like, when we calculated the cost of the raw materials, it came out to be under $600, which is really good because currently the stents that are bare metal stents currently used are on average around $650. So for a drug-eluting stent, $600, under $600 is a really good cost.
This is our current competition. The first company we look at is called Science. They use a metal stent coated in a fluoropacification layer, which has medication, and this is a combination metal and polymer stent. One of the issues with this company is that they have nothing in place to deal with restenosis, in addition to all the issues associated with normal metal stents. The second company we look at is called Absorb. They are actually one of the pioneers in biodegradable stents. However, they did not do much testing, and recently there's been an FDA-issued warning saying that they have increased heart complications post-implementation. This is because they did not do a long study and they did not check to see if there are any microcracks and other corrosion issues associated with their stent, and that led to mechanical failure, which ended up making it collapse within the heart. And the final company we look at is called the Dissolve scaffold system from Elixir Medical. This is one of the most promising companies we've looked at. However, they offer medication to address thrombosis and restenosis without much of a long-term solution, which we address with our VEGF protein layer.